Circumcision. Circumcision is a procedure that removes the foreskin from the human penis. In the most common form of the operation, the foreskin is extended with forceps. Then a circumcision device may be placed, after which the foreskin is excised topically or locally injected. Anesthesia is generally used to reduce pain and physiologic stress. It is usually elective, performed as preventive healthcare, a religious rite or cultural practice. It is also an option for cases of phimosis, other pathologies that do not resolve with other treatments, and chronic urinary tract infections. The procedure is contraindicated in cases of certain genital structure abnormalities or poor general health. Circumcision is associated with reduced rates of sexually transmitted infections and urinary tract infections. This includes decreasing the incidence of cancer-causing forms of human papillomavirus and significantly reducing HIV transmission among heterosexual men within high-risk populations. The WHO does not recommend circumcision for HIV prevention in men who have sex with men. Effectiveness of using circumcision to prevent HIV in the developed world is unclear. Neonatal circumcision also decreases the risk of rare penile cancer. A 2010 review found circumcisions performed by medical providers to have a typical complication rate of 1.5% of babies and 6% for older children, with few cases of severe complications. Bleeding, infections, and removal of either too much or too little foreskin are the most common acute complications. Meatal stenosis is the most common long-term complication. Prophylactic circumcision originated in England during the 1850s and became initially established as a means of preventing sexually transmitted infections. Beyond use in healthcare, circumcision also plays a major role in many of the world's cultures and religions and is also frequently performed for those reasons. It is among the most important commandments in Judaism. Campaigns of Jews' persecution have frequently included bans on the practice during periods of ethnocide. This includes prohibitions by the Roman Empire under Hadrian and the Seleucid Empire under Antiochus IV, both being used as a means of forceful assimilation and conversion. The latter empire's restrictions were a major factor in the Maccabean revolt. Circumcision have also played a major role in Christian history and theology. Though mainstream Christian denominations maintain a neutral position on routine circumcision, it is widely practiced in many Christian communities. Circumcised men are presently estimated to constitute around 38% of the world's population. In religion, the procedure is most common among Muslims and Jews and the members of the Coptic, Ethiopian, and Eritrean Orthodox churches. Circumcision is an integral or established practice for members of these faiths as well as among Samaritans and Druze. It is also widespread in Australia, Canada, Africa, parts of Southeast Asia, the United States, South Korea, and New Zealand. It is relatively rare for non-religious reasons in Latin America, parts of Southern Africa, Europe, and most of Asia. The origin of circumcision is not known with certainty. The oldest documentation comes from ancient Egypt. There are significant benefits in performing male circumcision in early infancy, and programs that promote early infant male circumcision are likely to have lower morbidity rates and lower costs than programs targeting adolescent boys and men. Worldwide, around half of all circumcisions are performed for religious or cultural reasons. Circumcision plays a major role in many of the world's cultures and religions. For infant circumcision, devices such as the Comco clamp, Plastibal, and Mohan clamp are commonly used in the USA. These follow the same basic procedure. First, the amount of foreskin to be removed is estimated. The practitioner opens the foreskin via the preputial orifice to reveal the glands underneath and ensures it is normal before bluntly separating the inner lining of the foreskin from its attachment to the glands. The practitioner then places the circumcision device, which remains until blood flow has stopped. Finally, the foreskin is amputated. For older babies and adults, circumcision is often performed surgically without specialized instruments, and alternatives such as Unikirk or the Sang ring are available.